Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? Hey, this is Christian Brindle, wherever you are and however you might be listening to me today. Thank you so much for taking the time. I am your host, Christian Brindle. Every single week, me and my company, Christian Brindle Insurance Services, bring you a podcast episode where we discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. Folks, thank you so much for tuning in here today, folks. We got a lot here to talk about. This is episode 234 of the Everything Medicare Podcast. If you're not familiar with me, my name is Christian Brindle. I'm an author. I run a little insurance agency called Christian Brindle Insurance Services, located about 20 minutes outside of Salt Lake City, Utah. And today, folks, I'm here to talk with you about this COVID-19 vaccination. So before I get into this, I just wanted to quickly just throw out a little bit of a politically correct disclaimer, if you will. There's a lot of people on both ends of the fence on this thing, right? And the argument has been, from my understanding, that, certain people say that it's absolutely mandatory, you have to get it, this and that. And, maybe you shouldn't be allowed in public places or on airplanes or something like that if you don't get it. And there's a certain crowd of people that look at it this way. And then on the other end of the coin, on the other side of the coin, there's a segment of the population and a segment of people that believe that it's not safe, it's sketchy, hasn't been tested enough, was pushed into manufacture to be manufactured too quickly, rushed, if you will, without taking the proper precautions. I'm not here to take a stand on either one of those today. So whatever your stance might be on it, that's fine. Today we're just here to talk about if it's covered by Medicare and the whole 9 yards that it comes down to with that. I'm not here to get political with you guys. I try to keep the politics out of it as much as I possibly can, even though we're dealing with something that in nature is quite political. And sometimes it's more of a challenge than others to keep the politics out of a conversation like this, but it's not something that I really want to get into today. So, just so you know, I'm not swinging one way or the other on my views and topics today. It's mainly just about if you are a person that wanted to get it and you're on Medicare, how is it covered? That's what we're here to talk about. So AARP put out an article that I'm going to be reading a little bit from on this that kind of dictates but it kind of explains a little bit how this is going to work and how it's going to be covered. So here's how it works with Medicare based on this article from AARP. I'm going to read it to you. Beneficiaries cannot be charged for the vaccine by providers who participate in the Medicare program. All copays and coinsurance payments by patients are also waived. This applies to all Medicare enrollees, whether they are enrolled in Original Medicare or a Medicare Advantage private insurance plan. Providers who participate in Medicare will receive an administration fee for giving COVID-19 vaccine shots to patients. The Centers for Medicare and Medicaid Services, quote-unquote CMS, has established a fee schedule for the 2-dose vaccines, such as the two different vaccines. I just know I'll butcher the pronouncements. That gives providers a $16.94 reimbursement for the first dose and a $28.39 for the second. If any single dose vaccines are authorized, Medicare will pay the providers $28.39 for that shot. Now, in terms of Obamacare plans or Affordable Care Act plans, also known as ACA plans, marketplace plans, Health insurance plans that were in effect before ACA 2010, ACA stands for Affordable Care Act plans, and short-term medical plans, both of which do not have to be ACA compliant, are not required to cover the COVID-19 vaccine at no cost. They can request reimbursement from the HHS Provider Relief Fund, but cannot bill patients directly. CMS suggests that if the beneficiary is charged by a Medicare provider for administering the vaccine, that they contact the Medicare hotline at 1-800-MEDICARE, aka 1-800-633-4227, to report the charge. If Medicare actually pays the provider for giving the vaccine, the beneficiary would be entitled to a refund. So there you go. That is the short answer. If you're on Medicare, whether it be a Medicare supplement or Medicare Advantage plan, you should not be charged anything for the vaccine. Right from the horse's mouth from CMS, the Centers for Medicare and Medicaid Services. We've gotten a lot of calls at our office about this, so I thought it would be a perfect thing for us to talk about today on a podcast episode and kind of answer that question. And this is fairly an important topic to discuss because there's always wonders on, what Medicare is going to pay for. Medicare has, for the most part, it's pretty straightforward and, in terms of the medical benefits and things like that. But there are some things that Medicare is fairly strange with. An example, we've done entire episodes about this in the past, but Medicare doesn't cover a physical after your first year if you're on original Medicare. Medicare Advantage plans do cover physicals typically every year, so that's a bit of a different story. But in terms of original Medicare, if Medicare Part A and B are your primary coverage, and say you have a Medicare supplement as the secondary coverage, Medicare doesn't cover a physical after your first year. The first 12 months, they give you something that's known as your Welcome to Medicare physical, where they'll pay for one. After that, they won't pay for one ever again. They'll cover something that's known as a Medicare annual wellness visit, but that's essentially, it can be looked at as a less detailed physical. They don't check as many things. They don't do blood work, things like that. People on Medicare all the time go in for physicals. They'll get their physical done, and they'll walk out, thinking that it's going to be paid for, and then they'll get a bill a month or two later for $300, $500, $600, $700, depending on the clinic, depending on what they actually do, depending on a bunch of stuff. Essentially, folks, one thing that you really, really, really just have to keep in mind with Medicare is not all vaccines are covered under the medical cost as well. The new shingles vaccination is a good example to this. Now, typically most vaccines are, right? Like the flu vaccine or something like that. A majority of vaccines are going to be covered under preventative care, under Medicare and Medicare Advantage plans for no charge. So this is really not that much of a surprise on the COVID vaccine, especially because I believe that the government is really pushing for people to get it. Now, whether you believe, like I said at the beginning of the episode, one end of the spectrum, of course, over the other, or vice versa, you probably have an opinion on that in terms of why they want people to get it so badly. But the government's going to make it very easy for you to get it, point blank. That's why they've authorized marketplace plans as well as Medicare and Medicare Advantage plans, essentially not really authorized, but required them to cover it at no charge. But as I was saying about the new shingles shot, the new shingles vaccination, it's covered in the Medicare world, but it's not covered as a medical charge. This is a call we get all the time as well. This is a weird thing to where it's covered as a prescription drug charge under your Medicare Part D plan. And a lot of times it's covered as a Tier 3 or above. Essentially what this means is if it's covered as a Tier 3 or above, if your plan has a deductible, maybe $200 a year on Tiers 3 and above, which is pretty typical for Part D plans and also, Medicare Advantage plans. Part D plans can have deductibles as high as $445 in 2021. You have to meet that deductible before you get any coverage. So sometimes those shingle shot vaccines catch people off guard quite a bit. So there are things that you need to be aware of. But in terms of this vaccine with the COVID vaccine, it's essentially covered at 100% charge, no matter what kind of plan you have, no matter whether it's a Medicare supplement plan or whether it is a Medicare Advantage plan, you should be able to get it no problem. I think the bigger problem you'd have if it's something that you want to get is just being able to get it as soon as possible, because from everything I've been able to hear, the demand that has been out there for it has not been able to coincide with the supply that's available. It seems to go really quickly. When they have, let's say, a supply available at a certain area, it seems to be gone rather quickly. So I think your bigger problem is just getting it in a timely fashion than having it covered by your insurance. But if you have the opportunity to get it and you're on Medicare, you should not have to worry about any out-of-pocket. Anyway, folks, little short episode here for you today. Not a whole lot for me to say on this because I'm not going to get political with you. I don't want to. It's not what I'm here to do, but this is a shorter episode that I just wanted to bring you and just kind of answer that question for you. Hopefully this puts a lot of minds at ease. We've been getting a ton of calls the last 2-3 weeks about this in our office, so I wanted to make an episode about it and kind of clear up the confusion on that. As always, folks, if you enjoy listening to us week after week after week, and I know that this episode's shorter than normal, but usually our podcast episodes are a good 20 to 40 minutes in length now. We're not really doing breaks because we just haven't had a lot of sponsors lately to do breaks for. But we're licensed in about 35 states. And if you're listening to us on a podcast platform that allows you to read the notes or the episode notes, we're going to have them in each and every episode now. So if you'd like help with your Medicare plan, give us a call. 801-255-5340, 801-255-5340. We'd love the opportunity to be able to help you. We work with all of the biggest insurance companies in the industry today, and we take great pride in providing good service. As always, folks, thanks for taking the time. Thanks for watching. We'll be back next week with another supercharged episode. Have a great week. Take care.